All right, so I'm so excited. Thank you, Dr. Rahman, for being on this conversation today. And this is something that's very personal to me because last year, December of 19, well, we're in 2020, December of 2020, I'm sorry, I had a hysteroscopic myomectomy. I had fibroids. And, initially, yes. And so today we're kind of talking on the topic of fibroids. Let us know who you are, your expertise and all that good stuff.
Okay, well, thank you for having me. Thank you. I appreciate the invitation, and I will do my best to try to shed some light on the subject because for Black women, fibroids is a very big deal. But a little bit about myself. I am a board certified OBGYN. I have been in clinical practice probably more years than I want to say at this point. And right now I have I call it a boutique GYN practice in Philadelphia. And I focus, and I see all women, all ages, but the focus, the specialty is midlife female care. And midlife is 40 to 64. A lot of things happen to women in that age group. Abnormal bleeding, fibroids become symptomatic, perimenopause, menopause, it just goes on and on. So my focus is midlife female care, pelvic, vaginal, sexual health. And one of the big deals are fibroids. And when I say fibroids, the word is very familiar to women, but they're not always certain what it is. And so I need to start off by saying fibroids are not cancer, although they are solid growths that develop within the muscular wall of the uterus, of the womb. Sometimes they can grow on the outside surface, sometimes they grow within the wall, and sometimes they can actually push into the cavity of the uterus. When someone has a submucosal fibroid, that's a fibroid that's pushing into the cavity. And often that woman might have a hysteroscopic myomectomy to remove that fibroid that's pushing into the cavity. And so fibroids can grow to great sizes. Sometimes fibroids are on the outside surface and they can grow so large that a woman might even look as though she's pregnant. And so because they are so common, one of the symptoms that we often see associated with fibroids are pain. And the pain can be in a variety of places depending on the location of the fibroids. If you have a large fibroid pressing on your left side, you might have left-sided pain. If you have a fibroid that's pressing on your bladder, you might have urinary type symptoms. So location of the fibroids, size of fibroids, number of fibroids are very important. And so these are benign growths. They grow within the cavity of the uterus and they create a nuisance in the life of women. In addition to pain, the other big issue is abnormal bleeding. And usually the abnormal bleeding with a fibroid is your bleeding starts, but it just doesn't want to stop. And you bleed and you bleed and you bleed. And one of the consequences of heavy bleeding is anemia. Yeah. And as the result of being anemia, you're tired, you're fatigued, you're not sleeping well. All of those things enter into it. So usually we say to women, do you have fibroids? And one of the easiest ways to document that, other than by just palpating them, is doing an ultrasound. Mm-hmm. Do you have fibroids? And then are you symptomatic? Meaning, are you having abnormal bleeding? Are you having pain? Are you having problems getting pregnant? And so that's how we start to evaluate that. Very common in all women globally, but particularly for African-American women. They say that by the age of 50, 80% of African-American women will will have fibroids.
So I
That's
do have a
huge.
question. That is huge. So is it like a genetic component? Is it diet? Like what causes
Oh,
that?
so this is where we start to show our ignorance of fibroids. We really don't know what triggers the development of fibroids, and we really don't know what causes them to grow. A woman might have one fibroid, the woman beside her might have 10 fibroids. One woman might have small fibroids, the other woman might have huge fibroids. We sometimes see it in families, like my mother had it and my grandmother had it, but we don't necessarily think it's primarily genetic. It's not as though you inherit the fibroids.
Okay.
So,
Because in my situation, and we kind of briefly talked about it a little bit before, was I had quite a bit of the symptoms. I had really heavy periods. I was tired. Um, but I didn't know that it was fibroid related until I went in and had a pelvic and an ultrasound, and oh, there you go. You have this going on. And the bleeding was so heavy that, it was like, is this what it's like if you have a miscarriage, because of the clotting and just how heavy it was kind of scary. But my mom had fibroids. My aunts all have really heavy periods. And so that's when I went on the road to search and to figure out like what could I do.
sure. That's a very important point because one of my interests is looking at non-surgical ways of treating fibroids. Women tend to suffer with their fibroids for a long period of time because they know when they go to the doctor's office, usually there's going to be a surgical answer, and they don't want surgery. So they try to deal with it. In my limited research, I'm seeing that diet does play a huge factor in it. We have seen that there's an association between vitamin D levels and fibroids. Low vitamin D levels, which is very common in African American women, increased risk for fibroid tumors. We know that there are chemicals that are put in our foods. They're called EDCs, endocrine disruptive chemicals. And these chemicals can look like and act like hormones. And so we're giving our bodies chemicals and hormones, and all of this is a compounding factor. And we also know that there's something called epigenetics, meaning we're born with a certain set of genes. But as a result of diet, as a result of various encounters, as a result of medications, we can actually alter our genetic makeup. And so that's epigenetics. So in a sense, it is genetic, but I think a huge part of it has to do with diet. I think that's huge. Chemicals, there was a recent study that said Black women use a lot of different hair care products. And within those hair care products are these chemicals, and these chemicals get absorbed into our system. So we are exposing ourselves through our diet, through our personal care products to lots of chemicals. And so we have to look at the whole picture, and from a physician's perspective, we have to be able to give women options and alternatives. And I think we need to diagnose. We need to do a better job at diagnosing fibroids early. I really don't want to see you after you've been bleeding a whole year with heavy periods and you're anemic. I want to see you when your fibroids are still relatively small, where we can start to do things that will start to impact on the fibroids and on the size, so something that's a little more proactive than just let me do a myomectomy or let me do a hysterectomy. And so that's where I'm trying to go, but it's hard. It's hard because a lot of times we're talking about reevaluating lifestyle and choices that you make in terms of foods, in terms of products that you use. All of that plays a factor in it. So
you hit on a lot of great points. So me being a patient, sometimes you do feel uncomfortable having the conversation. You may feel like I don't really know what to say, and you're a
yes.
little apprehensive. So what suggestions would you give to women out there when they're, having this conversation with their doctors to feel more confident to get the best health care?
Sure. I would first say, don't wait, because I find that what happens is women will talk to their girlfriends, they'll Google, they'll try X, Y, and Z. And when none of that's working, then they'll come to the doctor, and then things will be far gone. Okay, so don't wait. Be proactive about your health. Ask questions. If you feel uncomfortable, if you're feeling like you're not getting the information, go elsewhere. Get a second opinion. You are actually giving that doctor permission to work with you to help manage your health. That's an honor and that's a responsibility that requires communication. And if you don't have that, that's not the one. Now, that's hard to say. It is hard to say because there is this relative power imbalance.
Yeah.
You're there with the doctor, but it's your body and it's your health. And so if you can't get your questions answered, that's not the place. You need to keep looking, or at least get a second opinion, about whatever's being said.
Yeah,
And
yeah.
and it can be challenging. I'm not trying to make that sound simple or easy, but it might make the difference between getting a surgical option versus a non-surgical option. It may mean the difference between feeling totally or feeling as though you can't really ask the questions that you really want to have answered. And that's not the situation that you want to be in.
Right. And that happened to me, and actually I went and got a second opinion. And I think as women, so naturally we always have conversations, thankfully, we talk to each other. And it was because of a client
Yes.
who sat in my chair and shared her experience with me. Her situation ended up being a little bit more severe. However, she was able to tell me about her doctor. I'm like, you know what? I need to see that physician. I need to
Good,
talk to him. And it worked
good.
out really well. We were able to communicate. I shared my concerns and even the vitamin D. I also had a vitamin D deficiency. And months before, I had seen an integrative health doctor, and she says your D levels are pretty low. And she said, I suggest that you go on, this amount of vitamin D. And this is probably a couple months before I had seen the surgeon. And I actually looked up vitamin D and the connection with fibroids. It happened to show up, and maybe it could have been our conversation. I found it because of that, and I shared that with him. And he's like, you know what? Thank you, because I'm going to keep this on record here. And this is a research hospital in my area that
Good,
this doctor
good,
is at.
good,
So I'm like,
good,
this
good.
is nice. This is good.
Yeah, I mean, for the longest time, we have not had a good answer for women with symptomatic fibroids.
Mhm.
And so what we would say when it got too bad, do you want me to take it out? And that was pretty much, for a long time, that was the only answer. And many of us have been trained that way. We're going to wait. And when it gets really bad, I can tell you, I can take it out.
Right.
And then you'll be so tired and frustrated with the situation that you're willing to have me take it out. And so we just need to change the whole paradigm. And part of that means helping physicians to understand that there are other options becoming available. We're just starting to do more research as to why. We were satisfied, it seems, for a long time, just just because, which may have something to do with how we regard women's health, but that's a whole nother issue.
Right. Yeah.
But now people are realizing, or now women are advocating. Just recently, it was Representative Yvette Clarke and Congressperson Kamala Harris, who introduced a bill into Congress to study for more research and more study. And that's huge. That's huge. I mean, because there's finally the recognition that we need to understand this better.
Yeah, we do. There's so much. And when it comes to research, that you mentioned the word research, Google tends to be our best friend. It could be good or bad. What about social media? How do you find answers? Should I go on social media? Like, what's your take on that?
So a case in point is hair loss, fibroids and hair loss. This is a great case in point. And I made some notes here because 3 women in 2018 did a retrospective review of medical charts of Black women over the age of 18 who have been admitted to Johns Hopkins Hospital. And so they looked at a total of, it was a huge number. It was 487,104 Black women over the age of 18 who have been admitted to Johns Hopkins between 2013 and 2017. So in that 4-year period, over 450,000 Black women have been admitted. And of those women, they looked at their medical charts to see, first of all, and these were dermatologists doing this study. They wanted to see how many of these women had alopecia. That specific is called CCCA, a specific type of alopecia which predominantly affects Black women. Basically, you start losing hair at the crown of your head. It kind of spreads out like in a circle. And then the area involved basically scars over. So there are no hair follicles in this area. So there is no hair growth because you have no viable hair follicles. And they see this predominantly in African-American women. So these dermatologists looked at all of these medical charts to see how many of these women that had been admitted to Johns Hopkins in this 4-year period of time had this type of alopecia. And they came up with, out of that 487,000, it was 443 Black women had this particular type of baldness. And then they looked at, of these 444 women, how many of these women also had fibroids? And they saw that 62 of the 44 women with the hair loss also had fibroids. And then they said, well, I wonder what's the ratio of women who don't have this problem with fibroids. And so when they looked and ran the numbers, they saw that 13.9% of the women who had the hair loss, the alopecia, also had fibroids. When they looked at the Black women that did not have the alopecia, only 3.3% had fibroids. And so they said there may be an association between this type of baldness and fibroids, because we see it's more common, fibroids are more common in the women that had this type of baldness compared to women that did not. And so their recommendation was, if you're a dermatologist and you see a Black woman that has this particular type of baldness, she should be screened to see if she has fibroid tumors. And so that was the study. But what happened, or what happens with social media, you get this information and it starts out saying something like, there's a link. there's a link between fibroids and this particular type of baldness that affects Black women. And we know fibroids affect Black women more often, so there must be an association. So it starts off saying there's a link, and then if you look over time, it starts to say fibroids are the cause for this baldness. And so the information kind of gets twisted. It's kind of that, you know, that game where you whisper down the lane. By the time it gets to the end, it's like, that's not what I said. And so that's why the caution is we all look at social media. We all do medical research using Dr. Google, but you need to take it with a grain of salt, and you need to have that information research and not just take it on face value all the time. And so this is a perfect example of going from women with this particular baldness have an increased risk, or we see an increased incidence. And they didn't even say we know that the two are related, but we see it's more common with these women. And we don't know the relationship, but it's notable compared to women that don't have it. And so, and then I have to say that there have been studies since that particular study said we don't really see a relationship, you know, because that was one retrospective chart review that was not confirmed by another person. Now, usually things only become factual when you can repeat it and confirm it each time, okay? And so this is a great example of we have to look at social media, but we also need to have a certain level of, you have to show me, you know, you have to prove it to me. We just don't take everything at face value that we see online.
Yeah.
And in fact, this type of baldness, and they've been looking for an answer because not everything is well understood in medicine. Fibroids being an example, this specific baldness that's being seen with Black women. For a while, they used to call it hot comb alopecia. And because the thought was, it was because of the hot comb that was being used in women's hair. Not proven to be the case, but people often go back to it's what Black women are doing to their hair. But then the question becomes, even if that's true, why just here, you know, and why that? And so we have a lot of questions. We just have a lot of questions that need to be studied and researched, you know. And so I think the first study was a great study, but we just can't stop with one study. And we can't believe that one study necessarily is true. You know, you may find out that there were confounding factors that made it look that way when it really wasn't the case.
I'm so happy you said that, because I've seen it, you know, that study, and I've actually, I mean, I've shared it with other people and everything, and I've you know, seen different stuff. And because you do wonder, because you don't know. I mean, before I had heard the study, I've been in classes and heard dermatologists say that, well, yeah, it's, you know, like you said, hot comb, or it's from, you know, chemical relaxers, or it's something that only, you know, Black women get, which is not true. CCCA is seen in a lot of people, not just Black women. So it's, you know, that's, I agree with you. It's important to get the whole story and the background
The
of
whole
everything.
story. I think what these doctors did in 2018 was huge. They raised an issue that was going unstudied. You know, people weren't paying attention to it. And so it's huge. It's a great introduction. It may not necessarily be the gospel, but it is where we start, you know, and where we continue our evaluation and investigation.
Yeah. So staying on the topic of hair loss, like, have you seen that quite a bit with your patients with women because of the anemia side of it? Has that, or even after hysterectomies, I've you know, I've had clients being thrown into early menopause. They're my age and I'm in my 30s, and they've been thrown into early menopause and they're
Sure.
experiencing the hair fall and everything.
That's an interesting question. And to be perfectly honest, it's not often that a woman comes into my office and will talk to me about hair loss. I think we segment healthcare a lot, meaning that if I have hair loss, then I'm going to wait and make an appointment with a dermatologist. Or if I have hair loss, then I'm going to wait and talk to my esthetician or my beautician. And that's not what I go to see the gynecologist about. So we kind of chopped up the human body into these little segments, like this is what I do. And if it's not, if it's not fibroids, I don't really, need to talk about it. And so I don't get a lot of complaints about hair loss. Doesn't necessarily mean that it doesn't happen. I just don't hear it. What I do hear women talking about, and these are usually perimenopausal, menopausal women talking about hair thinning. Mm-hmm. And I don't know, because I really haven't dug deep, is hair thinning a euphemism for hair loss, or whether it's just hair thinning? I mean, associated with the perimenopause and the menopause is dry skin, dry eyes, thinning hair, hair loss, not so much. But I may need to do a better job of asking.
Mm-hmm. Yeah, like I said, for me, I've had quite a few clients that are in their mid 30s, early 40s, and because the situations have medically been put into early menopause and not really knowing what to do, or the whole hair situation, and they're really stressed out by it. And so, me, like, I'm trying to find the solutions for them, because I know some things are hormone, and it could also jumpstart something that might be going on genetically with them, things like that.
So we know that with perimenopause or menopause, that there's a decline in hormone levels, specifically the estrogen. And we know that there are receptors for estrogen on hair follicles. And so there are connections. It's like the song, the ham bone's connected to the knee bone and all that type of thing. It's all connected. It's all connected. It is incomprehensible to me that there could be a global change, but without global results, And so the question is how best to deal with it,
Yeah.
And so that's how we need to look into, if we're talking about menopause and declining estrogen levels, what can we do? Are there things that we can eat that will help to ameliorate our symptoms? Mm-hmm. I have a pet peeve with, I think women are almost held at prey, because you can go online and see these wonder cures. All you need is a pearl, or all you need is this, or all you need is that, and it'll take care of all your female concerns. And I really see it as a disservice to women. I see it as a disservice to women to say that whether it's infertility, fibroids, vaginal discharge, this thing is going to take care of it all. I think, and that's not to dismiss herbs, because herbs work. I mean, that's what we used before we had quote unquote medications. So herbs work, but I think too often in this society, people are quick to wrap something in a package, call it holistic, and throw it at women as a cure-all, a be-all and cure-all. And I think that's my problem. I don't have a problem with herbs because I believe they work. But but I do have a problem with these quick, fast, easy, and all you have to do is send me $29.99 cures. And so,
Yeah. So with that said, because a lot of women are searching for things, like with myself, when I was going through that phase and that transition, I was looking through my diet. I was doing acupuncture, which it did help. It's a slow process, but it did help. And some other things. And I also was on the hormone replacement, but a side effect for me was it caused hair fall. It caused my hair to shed out really bad.
oh,
Yeah, yeah. It was pretty bad for me. And that was like part of my whole journey with, doing something different.
yeah. And this is kind of what gave birth, no pun intended, what gave birth to my current practice. A lot of times we focus a lot on her having a baby, which is important, which is huge. But women have all these other issues that come along, and we need to be paying attention to that. And I think it's like, well, if you're not having a baby, if you're of a certain age, just deal with it. Just deal with it. And I think that's not the right answer. And I also think that one size doesn't fit all. So you have to kind of tailor it to the woman, her circumstances, what she believes, what she's willing to do. And then you just keep tweaking it until you get to something that works. But that implies that there's a relationship where we're sharing information,
Yeah.
okay, I'm willing to do that. That didn't work. Okay, let's do this. So it's a whole different type of relationship. It's a different type of dynamic where we are working together, because whatever I suggest for you, you will know before I do whether it worked for you.
Yeah.
And
Yeah.
then I need that type of feedback to say, okay, well, let me give you a little more, or let me give you a little less, or why don't we add this, or maybe let's try a different. And so those are the kind of things that need to happen, but that can only happen in the context of a doctor-patient relationship where you have that comfort level and enough time. A lot of times there's just not enough time to say everything that you want to say.
Yeah. Yeah. I mean, there's so much. This has been such a great conversation because I'm replaying my experience over the years through my head. And, just seeing like, yes, there is so much. And, as a patient, you've lived in your body for X amount of years. You know how things should feel, when you feel off.
Yes. Yes.
I took myself off the medication because, well, first it started out at a small, like 10 milligrams, but my cycles still weren't getting better. It's like, oh well, you can go up to 4, which is like 40 milligrams. Like, okay, perfect. But I think it was at that point that when I upped the dosage, then that's when I started experiencing with my hair. And I didn't know that that was, one of the side effects of it until after I shared it with him. He's like, oh yeah, that is something that people do see. I'm like, I didn't know. But I think for me, I'm happy that I went through with the procedure because my body doesn't actually like hormones. It prefers that procedure. And I don't know why I waited so long. I think I was scared, but for me personally, it was the best option. It was the best option. I was a
Absolutely.
successful surgery, very successful.
So there are options, and you are absolutely right in that you need to pick the best option for you. One size does not fit all. And luckily, more options are becoming available. There's the hysterectomy where you remove the uterus, okay? And there are different ways of doing that. You can do it laparoscopically, robotically, vaginal, all those different type of ways, but they all have the same endpoint: remove the uterus. Then you can have a myomectomy, where you're saving the uterus but shelling out the fibroids. And you can do that vaginally, hysteroscopically, laparoscopically, robotically, all different ways of doing the same thing. Then you have what I call the intermediate procedures, like a uterine artery embolization or an endometrial ablation. And these are procedures that can be done that sometimes are all a woman needs, especially if, for instance, if she's almost to menopause, we think it's just maybe another couple years and we want to tide her over. Maybe this type of procedure is the answer. There are medications, a lot of different types of medications. Most of them, many of them are hormonal, to help to regulate a woman's cycle. And there are different ways of taking it. And then there's another medication specifically for heavy bleeding, or 2 other medications. So there are lots of different options that are becoming available. And it kind of depends on the woman and where she is in her life. Is she still young, trying to have a family? Is she older and definitely doesn't want to have any more kids? So you have to figure out where she is in this whole scheme, and then pull from the toolkit and find something that works.
Yeah, so much good information, so much good information. So I wanted to touch on the topic of food one more time, because there is, I think now everything is, a lot of people are going plant-based, and there's a healthy version of it and there's a junk food version of it. Look, Oreos are vegan. I can have Oreos anytime I want. It's vegan. But
Yes,
it's yeah.
a junk food vegan. Yes. So I am a plant-based believer. I am a plant-based believer. There have been medical studies that have shown that if a woman will go onto a plant-based diet, her cramps will lessen. Okay? The problem with it, and I have said that to patients, I have had patients do that, and I have had them come back and say, my cramps either disappeared or my cramps have gotten significantly better. Know that to be true. The problem is, it's hard to do. It's hard to do, because we are tempted by all of these things and we want them and we eat them. But you can lessen your dysmenorrhea or your cramping with your period by consuming plants and vegetables as close to their natural state as possible. Meaning, you don't, if you're going to have a potato, you don't want French fries, you don't want to dip it in oil. You want to minimize the meat, including fish. And people go like, oh, but meat, including fish, dairy, including cheese. And that's huge for a lot of people.
Yeah.
But I say, I don't try to convince anyone of this anymore. I say, try it. And then depending on how you feel, you decide, but give yourself the gift of seeing what it's like. A lot of people will tell me that they've done a cleanse. And a cleanse is sort of kind of like that, where you stop eating all of that stuff that you shouldn't be eating, and you try to eat better. And they say, and I felt better, and I lost weight, and my face isn't as puffy as it was before. But sustaining that is really the key, and so that's hard. I think that food is huge. Just recently, there was a study published in Menopause that said that if a woman added half a cup of soybeans to her food, and the food again is primarily vegetables and fruits, minimal oil, no meat and dairy, hot flashes got significantly better without taking any hormonal replacement. And part of that is soy is similar in structure to estrogen.
Mm-hmm.
And so your body kind of thinks it's like a cousin. It's like a cousin to estrogen. And so your body thinks, this is some estrogen. And so by consuming this soy, and they're in Instapots are real popular now. And they say cook it in Instapot and then put it in a salad or put it in a stew or put it in, but just a half a cup every day, symptoms got better. And that's huge because the pharmaceutical industry is making lots of money on HRTs. And if you can get a benefit through something as simple as soy and modifying how you eat, that puts you, I tell women, it puts you back in control. I think too often women enter healthcare feeling like things are being done to me. I don't really have a say on what's happening to my body. I can't control what's going on. It puts you back in control. Now, if you choose to do it, that's fine. But if you choose not to do it, it's still your choice. Where a lot of times you don't even feel like you have a choice. You're just being said, this needs to happen, that needs to happen. And,
Yeah, I never heard that about the soy, and actually, it kind of surprised me because there's another version to soy that people always talk about that, oh, soy causes this. You shouldn't eat that because soy, because it is high in estrogen or whatever, it disrupts. But you're saying something different. That's interesting.
I know there's been a huge debate about, is soy good for you or not? And so the more, and you're right, if you Google, you will find all of that. The more recent studies are pointing towards a benefit. And so, but just like any other study, you don't base everything on just one study. It needs to be confirmed and repeated. And, before you say this is truly gospel, but this one study did say that.
Okay. So I think it's given a lot of, no pun intended, a lot of food for thought, which is good. Because, depending on where people live, they can go, farmers markets are really good. There's a lot of ethnic stores, like where I live, there's a lot of Asian markets. And, you can definitely find good tofu, and what's the other one? Starts with an S.
Tempeh.
Tofu tempeh, but there's
Seaton?
another one. Yes.
Seaton.
Yes.
Yeah. And so when you're being a purist, and it's probably hard to be a purist, you're really focusing on fresh fruits and vegetables, beans, and pasta. You can have pasta, but you want to focus on that, limiting the meat and the dairy. There is a doctor in Houston, Texas, who has been able to help people reverse cardiovascular disease by going on a plant-based diet. And this is not the junk food vegan. This is truly plant-based diet. They have been able to improve their medical condition. And what's so amazing about that is that heart disease is the #1 killer.
Yeah.
If you are a Black person over a certain age, I used to say 50, but it's probably even lower now. You probably have high blood pressure. you know? You're at a higher risk we are at a higher risk for diabetes. And those two things, high blood pressure, diabetes, often lead to renal failure. And renal failure, needing dialysis or needing a transplant, that's a whole nother medical problem concern that I don't think anybody would want. And so if you can control, reverse, limit the effect of all of that by changing how you eat, it's huge. And so when they say food is medicine, that's really true. Food is medicine. So you can either choose to, take the Premarin or eat the soybeans. It's your choice, but it's a choice that will have consequences, and we're all adults and we all have one life and we all have to live it in such a way that makes sense. But I would think that we want to live a quality life. No one wants to be decrepit, in pain, can't move, so if you can optimize your health, then it seems to behooves us to do as much as we can for as long as we can.
Yeah, I like that. Optimize your health, control, reverse, limit.
Yeah.
It's your choice. You have control.
And it's
in
not
your
too
court.
late. And I think that was the other takeaway that I got from this doctor. His name is Dr. Baxter Montgomery, if anyone's interested. One of the takeaways is that you're not too old. It's not if you're, I'm already 50, it's too late for me. It's not too late for you. It's not too late. You can start to optimize your health today.
I like that. So if women wanted to reach out to you, Dr. Rahman, how can they find you?
So the best way is probably through the website. And the website is www.drrahman.com. And doctor is spelled out, DoctorRahman.com. And then the other way is to send an email. And that is mail, MAIL, at drrahman.com. And it's DoctorRahman.com.
Cool. I will post that. And is there a way, like if women want additional information about fibroids, is there like a PDF or something that they could read for later?
I do have a PDF. It's a very easy read. It's a very simple read. Just kind of talking about fibroids, showing a picture. Well, no, there isn't a picture. A lot of women are curious as what does a fibroid look like? I don't believe there's a picture, but we talk about the size of fibroids. And if someone says your fibroid is 7 centimeters, what does that mean? And how big is that?
That's scary.
Well, I'll tell you this. A tennis ball is 7 centimeters in diameter.
Okay.
So if they say it's the size of a tennis ball, that's about 7 centimeters.
Okay, that's good to know. So they can go to your website to find the PDF?
Yes. Well, if not, no, if they send me a request through the email, I can then give them the link for the PDF.
Okay. I'll be sure to share that. I appreciate it. This has been such an enlightening conversation, and it's more women need to have this open conversation. I think we suffer way too much in silence. And we've had, all of us at some point have experienced accidents in those moments of like, wow, why did I wait so long for to have something done? Or I had no idea this was my option. I thought they had to do a hysterectomy when there's other options. Or what, not really, I don't think I'm a candidate for hormone replacement therapy. Maybe I can try changing my diet. So you covered so much
Sure.
information that's been so helpful.
So
Yeah.
I want to thank you, because it's women such as yourself who are reaching out to physicians, trying to find out what is the real deal. What is the real
Yeah.
deal? What can we believe? What can we not believe? How can I help my clients that I see? Because we all know when you're talking to your beautician, that's a very special time and place.
Yeah.
And so the fact that you're taking the time and making the effort is to be commended. So thank you for the invitation.
You're welcome. You're welcome. So this will be the end of our conversation, and don't forget to definitely check out Dr. Rahman's website and also the PDF if you're more interested in the PDF that she offers. You all have a great day.